May I now invite on stage Dr. Gopi Krishna Yedlapati, Interventional Pulmonologist, Yashoda Hospitals, Secunderabad. Let's give a huge round of applause for all the honored dignitaries and Senior Consultant, Internal Medicine, Apollo Health City, Hyderabad, to please moderate the session and take it further.
Good afternoon. I'm audible? At the outset, my sincere thanks to Dr. Puri Rangareddy Garu for giving me this opportunity to be amongst you people. This is something which is, I would say that we are coming back to almost near normal situation. If I say this, it's only because I was joined by Harshita, one of the organizers, and I was going through the stalls. Something which is really amazing, the newer innovations, and believe me, as medical fraternity, we have a so-called tubular vision. We are confined to the patient care. We are totally ignorant of what's happening outside the hospital network. But yes, you people also are contributing, or you have already contributed a lot in controlling the so-called COVID pandemic. Once again, my so-called thanks and also appreciation for the younger generation, and I would get started with my talk, which is quite short. Non-communicable diseases and the impact of COVID pandemic. In fact, the organizers wanted me to talk on a post-pandemic world, but I was just discussing with Modi sir, the pandemic has not yet ended. It has slowed down in India, but in Europe and USA, it is still raging. So I would say that the pandemic is still continuing. And what's the impact on this so-called non-communicable diseases? By using this word non-communicable diseases, I am very specific. There is a subset of population, in fact a larger section of population, which has all these problems like diabetes, hypertension, dyslipidemia, coronary artery disease, cardiovascular disease, and the end organ failures like CKD, chronic obstructive airway disease, reactive airways, and ending up with interstitial lung disease. When you come to the gastrointestinal system, you have the cirrhosis of liver, osteoporosis, and few cancers. And by and large, as the lifespan is going up, we are coming across the neurodegenerative diseases like Alzheimer's and then Parkinson's. To add to this burnt, we have this so-called psychiatric illnesses, depression, schizophrenias, generalized anxiety disorders. All these things are a part of the so-called lifestyle diseases which have erupted over a span of a century, thanks mainly to our changes in the life. We have been hit by a COVID, which is a viral infection, which is by and large communicable. So at one end you have the non-communicable diseases, over which there is a pandemic of a communicable disease, and you can see the extent of damage which it has done to the entire world. All of us are by now well aware of the fact that the etiology is the SARS-CoV-2 virus. initially taking origin from the Wuhan, China, and we had a first wave last year, and towards the end of this, probably 2020 and the early part of 2021, we started having the second wave, and it is still going on. There are different variants. Initially, we thought that it's only respiratory symptoms. Later on, as we started dealing such cases, we found that there is multi-system involvement. Acute phase, we have the so-called cytokine storm and a state of hypercoagulability, where the clotting tendencies increase, and ultimately we had good number of cases, apart from mortality, ending up with chronic sequelae, depending upon various systems, which our expert panel are going to discuss. So, the first wave, we were clueless, we started hiring, and that's where the telemedicine services got pitched in, and the innovators like you have really done an excellent job in offering the support systems. From the medical side, the acute phase, we used to tackle with steroids and monoclonal antibodies. Now, the second wave, mostly we have an antibody cocktail doing the job. It's an excellent job which is being done. Then antivirals like remdesivir, we had the orally acting antivirals like favipiravir, and the other one which is in store, which is going to hit the market, is the molnupiravir. We had also used low molecular weight heparin and newer oral anticoagulants like rivaroxaban and other anticoagulants, which are essentially the tablet forms. Post-acute phase, we use this particular term for people who have residual symptoms and signs or some extent of damage to the various systems. It lasts for 3 weeks to 3 months. And right now we are confronted with the chronic long COVID or a long haul COVID, which is the period more than 3 months. So friends, management of the so-called chronic COVID infection and sequelae depends upon the system which is involved. We have devised a so-called a package wherein we periodically review the case every 3 months, following the so-called SMS and other protocol. COVID appropriate behavior is the most important thing which we try to advise the patient and the attendants. And lastly, the vaccination, as Honorable Prime Minister has already declared, forms the mainstay, because we are yet to see the ideal antiviral. So friends, this is in short the history and how we have tackled so far the COVID pandemic. Now I have with me the privilege of discussing or sitting beside the expert panel, Dr. Modi sir, the senior endocrinologist from Care Hospital, Dr.S.somaSekhar Rao, who is the medical gastroenterologist, a colleague of mine at Apollo, and Dr. Gopi Yedlapati, he is the senior pulmonologist, and Dr. Mukharjee, the cardiologist, and Dr. Harish Reddy, the psychiatrist. An expert panel, they would be sharing their experiences. I would be first opening the session. When it comes to the cardiovascular system, COVID did affect the cardiovascular system in multiple ways. As an internal medicine consultant, I had seen cases of myocarditis, frank coronary artery disease, anterior wall myocardial infarctions, patients ending up with heart failure, cardiomyopathy, pulmonary thromboembolism because of hypercoagulable states, and also arterial thrombi. Dr. Mukherjee, I would like to know your personal experience and any common presentations which you have come across during this pandemic.
Yeah, thank you very much.
Here we have been hit by a COVID, which is a viral infection, which is by and large communicable. So at one end you have the non-communicable diseases, over which there is a pandemic of a communicable disease, and you can see the extent of damage which it has done to the entire world. All of us are by now well aware of the fact that the etiology is the SARS-CoV-2 virus, initially taking origin from the Wuhan, China, and we had a first wave last year, and towards the end of this probably 2020 and the early part of 2021, we started having the second wave, and it is still going on. There are different variants. Initially, we thought that it's only respiratory symptoms. Later on, as we started dealing such cases, we found that there is multi-system involvement. Acute phase, we have the so-called cytokine storm and a state of hypercoagulability, where the clotting tendencies increase, and ultimately we had good number of cases apart from mortality ending up with chronic sequelae depending upon various systems, which our expert panel are going to discuss. So the first wave, we were clueless, we started hiring, and that's where the telemedicine services got pitched in, and the innovators like you have really done an excellent job in offering the support systems. From the medical side, the acute phase, we used to tackle with steroids and monoclonal antibodies. Now, the second wave, mostly we have an antibody cocktail doing the job. It's an excellent job which is being done. Then antivirals like remdesivir, we had the orally acting antivirus like favipiravir, and the other one which is in store, which is going to hit the market, is the molnupiravir. We had also used low molecular weight heparin and newer oral anticoagulants like rivaroxaban and other anticoagulants, which are essentially the tablet forms. Post-acute phase, we use this particular term for people who have residual symptoms and signs or some extent of damage to the various systems. It lasts for 3 weeks to 3 months. And right now we are confronted with the chronic long COVID or a long haul COVID, which is the period more than 3 months. So friends, management of the so-called chronic COVID infection and sequelae depends upon the system which is involved. We have devised a so-called a package wherein we periodically review the case every 3 months, following the so-called SMS and other protocol. COVID appropriate behavior is the most important thing which we try to advise the patient and the attendants. And lastly, the vaccination, as Honorable Prime Minister has already declared, forms the mainstay, because we are yet to see the ideal antiviral. So friends, this is in short the history and how we have tackled so far the COVID pandemic. Now I have with me the privilege of discussing or sitting beside the expert panel, Dr. Modi sir, the senior endocrinologist from Care Hospital, Dr.S.somaSekhar Rao, who is the medical gastroenterologist, a colleague of mine at Apollo, and Dr. Gopi Yedlapati, he is the senior pulmonologist, and Dr. Mukharjee, the cardiologist, and Dr. Harish, Reddy, the psychiatrist. An expert panel, they would be sharing their experiences. I would be first opening the session. When it comes to the cardiovascular system, COVID did affect the cardiovascular system in multiple ways. As an internal medicine consultant, I had seen cases of myocarditis, frank coronary artery disease, anterior myocardial infarctions, patients ending up with heart failure, cardiomyopathy, pulmonary thromboembolism because of hypercoagulable states, and also arterial thrombi. Dr. Mukherjee, I would like to know your personal experience and any common presentations which you have come across during this pandemic.
Yeah, thank you very much. Yeah, COVID disease spectrum. Now, apart from the lung, which the COVID involves to begin with, if there is one organ which has most significance when it gets involved, it is the heart. Okay. Patients who are cardiac patients to start with who develop COVID have almost 10 times the risk of hospitalization or death as compared to people without heart disease. So that is number one. Number two, COVID affects the heart in multiple ways. Actually, the COVID virus can directly enter the cardiac cells and then weaken them. The COVID can cause clots in the blood vessels supplying the heart, and the COVID can cause endothelial dysfunction. Endothelium is the layer within the blood vessels, which is innermost layer of the blood vessels, walls. And when the endothelial dysfunction happens, the heart gets affected. And the cytokine storm itself can affect the heart, because there will be a demand and supply mismatch as far as the oxygen and nutrients are concerned, as far as the heart is concerned. So we have on the other hand a type 1 MI and a second hand type 2 MI. Both these things will increase. So how does the heart get affected? One, it may have a weakness of the heart, that is cardiomyopathy, or it can have rhythm disturbances in the terms of either the heart beating too fast, or heart beating too slow, or heart beating irregularly, or any of these combinations of rhythm disturbances. And then most importantly, that can present with increased biomarkers like troponin or BNP. Troponin elevation indicates myocardial injury. And myocardial injury can directly occur, as we discussed, or because of a low hemoglobin and low oxygen in the blood, low oxygen carried by the hemoglobin. This can also lead to an elevation of the troponin. So, heart diseases, apart from this, the pericardium can get involved, the myocardium can get involved, sometimes Takotsubo cardiomyopathy like picture can happen, and the problem is most of these patients will have chest pain and breathing difficulty as their symptoms, and chest pain and breathing difficulty are there anyway in the COVID pandemic, and then the diagnosis tends to get missed. The patient will be having breathlessness, suddenly he has increased breathlessness, and only if we carefully investigate for it, we will be able to find a cardiac cause. And then cardiac cause can easily be identified in a normal clinical situation. But here is a patient in an ICCU, And here are overworked health workers who may not recognize subtle changes like an elevated JVP or a new onset S3 in the heart. So these kind of signs are easily overlooked. So we'll be thinking that the COVID has progressed, and then we'll be increasing the dose of steroids, giving more immunomodulators, and then treating for COVID while forgetting the heart problem. So heart problems can get in myriad ways, and then they can be missed during a COVID episode. So that's why the mortality after a heart problem, which occurs during the course of a COVID pneumonia, has a higher mortality when compared to without that in a normal sitting. And then the other problem comes because lot of the people have stopped checking up for heart diseases. No checkups for heart. Now if you go to the heart cardiologist, there is a risk of developing COVID, so they will not come to the cardiologist. So in fact, all over the world, all the diagnostic procedures regarding heart disease have come down by about 50% during the first and second waves. The coronary angiography, the echocardiography, the stress test, all have come down. Even the people presenting to the hospitals with a heart attack have come down. The number of angioplasties have come down. The number of bypasses have come down. But what did not come down is the mortality. People were dying more because they were getting less checked up. People were dying more at home because they were afraid to come to the hospitals. This is not the situation only in India. In a developed country like Sweden, people with heart attack have been questioned, and then 20% of them, people with heart attack, mind you, not with a chest pain or anything, people who have had heart attack, they said 20% of them, we would not go to the hospital. In Sweden. In India, where the beds were a lot of problematic, and then people had less access to the healthcare, they suffered more during this pandemic. And another important thing is, the lifestyle has changed completely. Now what happened? Every person has started improving his immunity by eating more, by not exercising more, by eating more. And what did they eat more? They ate whatever they could. Like, be it grease, fat, whatever they could lay hands on, they ate. And then the BMIs have gone up, the waistlines have gone up, and people have started moving from a more active life to a more sedentary life. Now patients come to me and then they say, why have you increased in weight? Means they will not talk about the food. They will say, sir, corona pandemic, sir, walking karna nahi hua. Walking, invariably, this has come down during the COVID pandemic. And then less amount of follow-up, more amount of risk factors. The hypertension has gone up, the diabetes has gone up, obesity has gone up, cholesterol levels have gone up. All these have propelled the heart disease in ways that we did not see before. In the US itself, the life expectancy has fell by 1.1 year in US. In India, it must have fallen by more than that figure. We will come to that when in a retrospect only. We will not realize it now. So what I would advise, perhaps, sir, shall I come to that later? Or?
No, you can.
Yeah, what I would advise is the cardiac disease is going to go up in the next coming 2-3 years. The pandemic that we are going to see next may not be the third wave of COVID, may or may not be the third wave of COVID, but it is definitely going to be a pandemic of diabetes and hypertension and heart disease. Heart disease levels are going to go up, and then if you want to avoid that, and there is a clear way of avoiding that. If we want to avoid that, we'll have to adopt a healthy lifestyle pronto, right now, this moment. If you want to sit and listen to this talk, stand up and listen to this talk. Spend a couple of extra calories. So, modifying our lifestyle is the most important thing. Getting proper checkups done, checkups for hypertension, diabetes and cholesterol. These are the important things. But not only these, but the anthropometric measurements like weight also has to be carefully monitored. The food intake has to be moderated considering that more amount of eating will lead to obesity, which will increase the mortality with COVID-19, and any amount of immunity that you get through food is useless, and then the only vaccine-mediated immunity will help you in preventing a COVID-19 fatal situation. So the important thing is the immunity that you gain by eating more is not the actual immunity that you are going to get. Staying fit is different from eating more. That we'll have to understand and realize. And then we have to ramp up our facilities to be able to treat the avalanche of cardiac diseases that COVID-19 pandemic is going to spew at us. More amount of cases, cardiac cases are going to come. So we need to prepare hospitals, cardiologists, cath lab technicians, sisters, and most importantly, primary care physicians to detect this heart disease early, to treat it properly, and to reduce the mortality which is going to accost us in the next coming few years. Thank you.
One question. Initially, we thought of any comments?
No, this thing has bugged up the medical fraternity like no other question. No, initially we all know that SARS-CoV-2 enters the cells by means of ACE receptor. That we all know. So what happens to the receptor levels? If we give ACE2 inhibitors, the receptor levels will go up. If the receptor levels go up, there is an easy chance for the virus to enter the cell. That's why initially we thought people using these medications will be at a higher risk than the other people who are not using that kind of medication. But like so many other things in medicine, unless if it is proven directly, if it is taken from only hypothesis, it has a chance of getting wrong in 50% of the times. Now, if I tell you that taking aloe vera juice will help you in preventing from going to a severe COVID-19 infection, because aloe vera juice will have a lot of antioxidants, and antioxidants will help to deal against COVID-19. If I tell like that, I have a more chance of becoming wrong, because I have not given aloe vera juice for X number of people and then seen if they are getting better or not. Okay. So what ultimately they have done is, they have done studies to tell that people who are taking ACE inhibitors or angiotensin receptor blockers, they did not fare badly against COVID-19, as against the hypothesis which suggested otherwise. So after that, there are a couple of studies which have shown that actually these drugs may be beneficial in countering COVID-19. So the scientific opinion as of now is that people who are taking the ACE inhibitors and ARBs should continue to do so, and stopping or changing them while a pandemic is raging on may be more detrimental and harmful rather than continuing them. That's what is my opinion.
Thank you, sir. Now move on to the lungs, which also they have taken the brunt of COVID, and we have the expert pulmonologist in the form of Dr. Gopi Krishna. Initial symptoms always were respiratory, that every one of us have seen and experienced in our families. But you had the superadded bacterial infections and sometimes the deadly fungal infections, more commonly or specifically the black fungus. Sometimes the things could be stormy, ending up with acute lung injury, ARDS-like picture. And we had chronic sequelae like pulmonary fibrosis and increasing trends as pointed out by Dr. Mukharjee with regards to cardiology. With regards to lungs, we have increasing number of cases of interstitial lung disease. Now, Dr. Gopi Krishna, I would like you to share the personal experiences of yours.
Truly speaking, it was a horrible experience in the last 2 years. So we were working day in, day out, handling all different sorts of cases, running OPDs of hundreds of cases, as well as seeing IP cases which are like 120, 130 a day. So basically, the initial presentation of the disease is very mild. People used to go with the government, what you call advised protocols, staying at home and taking precautionary measures and basic medication. But unfortunately, few patients used to get worse and they used to land up in the casualties or the emergency room where they were requiring ventilations or high oxygen requirements are there. And these patients were the difficult patients to handle. It was not particularly about the age at all. We saw the patients who were young. We saw patients who were, in the teenage. We saw patients who were in middle age as well as the old age. So they were really, in a very bad shape, and where we had to struggle a lot to, give them the oxygen in whatever different way it is. And with all the medications cocktail, what was given by the, the medical fraternity, some said like the HCQs work, sometimes they say, remdesivir will work. So altogether, we could see that our experience states that, yeah, remdesivir does help in 10%, but the most important drug was steroids, and the blood thinners helped the patients a lot along with the oxygen. Altogether, most of the patients used to stay for 7 to 10 days, but we had patients who were staying with us for almost 4 months to 6 months too, on ventilations, different ventilations. Some are on portable ventilations like a BiPAP, CPAP, you guys might be knowing it, and some were on invasive ventilations, and we could see some patients were on double ventilation, we call it as an ECMO. So it was really troublesome handling those patients. Other than that, like sir has pointed out, not only the severity of the COVID per se we handled, we saw lots of infections too. The patients who are already existing, with us with ventilation, they had bacterial infections. Most of them were drug-resistant infections, and off late, patients were slowly lining up with the increase in the trend of fungal infections, whatever you could understand, the white, yellow, or the black fungus. So they can cause detrimental, damage as well as take the life of a patient, because there was a severe shortage of drugs was also there at that time. When we had these fungal infections, we could say that like an epidemic it started, and we saw a rise in tuberculosis cases because of usage of high doses of steroids and these monoclonal antibodies or immunosuppressants which we have used. So this is how it was basically. And once the patient started, improving, then we saw that the patients were dependent on oxygen, even the younger patients, the older patients, because the COVID has created sufficient damage in the lung, where the lung has become fibrosed, means it has become stiff and it doesn't help in the respiration. So we had to handle those patients that we push them into long COVID cases, and they need a sequential follow-up. And in patients who were not improving, even with the conventional oxygen therapies and all, we had to motivate them for the lung transplant, and we have done a few of lung transplants in COVID patients. Of course, the survival rate is a little lower, but we saw, survivors post lung transplant too. So this is how it was, and the worst part was, patient, they used to, they fared well for a few days and they suddenly dipped down. It can be due to the cardiac issue, or it can be because of the clots which they develop in the lungs. So we call it as pulmonary embolism. So where we use blood thinners to thin out the blood so that the clots are melted. So we still have confusion in treating those patients, because none of the drugs are proven, or none of the therapies are clinically supported with the evidence. So but still, I can say that in spite of all these confusions, patients are surviving. So that's what is human race is. And I can say like 95% people fare well with COVID. Only the 5% people take the support from the hospital, and they are the ones who are economically burdened over to the country or to the family. That 5% patients who need ICU care and high-end hospital care. This is what my experience was about COVID.
What's the percentage of so-called population which you feel that they might need an assisted ventilation support or some sort of?
We categorize into mild, moderate, and severe COVID. In the severe is only 5%. So in that, the ventilatory cases are hardly 2 to 3%. So when we look at the general population, the number is very, very low. But those are the people who needed us maximum when they were in crisis. So it is only hardly 2 to 3%. And very like 1% of people would be needing the invasive ventilation or the additional ventilations, we call it as an ECMO. That's what the, the statistics, what we saw in our setup, sir. Okay.
And a medical question to you.
Yeah.
How do you rate the rate of use of pirfenidone in interstitial lung disease?
In interstitial lung disease, especially post-COVID, the damage which the COVID has caused, there is a drug which we use like pirfenidone, and there is another drug called nintedanib. There are no studies per se, but personally, when we tried on those drugs on the patients, and we could see that there is a little, 10 to 15% benefit, or little, they were getting better faster when compared to people who were not on pirfenidone or people who were not tolerating pirfenidone or nintedanib. That was my experience, sir. Okay.
Thank you, sir.
Thank you.
I would have the gastrointestinal system taken the brunt of the COVID. In fact, we had cases where diarrhea or altered bowel movements can be the initial mode of presentation in COVID, in contrast to the respiratory symptoms. Mainly, it is the hypomotility or sometimes a transient disturbance in the liver enzymes, and very rarely, because of hypercoagulable state, you can have an ischemic bowel. The blood supply to the bowel gets knocked off, and this is an acute emergency. We also have cases like with bleeding tendencies. I have my colleague Dr.S.somaSekhar Rao, who would share his experiences.
Opportunity to talk here. To share my COVID, more than any diseases which are directly related to COVID in gastrointestinal tract, as you mentioned, most of them were minor except for that ischemic bowel disease, which we have seen maybe 1 or 2 cases. But rest of the symptoms related to COVID were definitely minor symptoms, and which can be associated with any viral illness. It can be nausea, vomiting, indigestion, or diarrhea. But what I felt was many of the non-COVID related disorders were neglected. Most of the time dyspepsia, most of them think indigestion, and they didn't come to the hospital for 6 months, 8 months, and it turned out to be a gastric malignancy, which would have been at a very, very earlier stage if we had identified 6 months ago. We have seen a lot of, I can't say them elderly patients, even people who are around 50 years, not coming to the hospital for constipation or bleeding per rectum because of the fear of COVID, and they turned out to have colon cancer. After 6 months of diagnosis, definitely the stage of the disease will progress. So I feel more than the COVID, the non-COVID patients have been affected very much during this time, and a lot of diagnoses were missed or postponed because of this, and definitely the outcome would have been much better if they had attended the hospital in time.
I think this point is to be taken.
That's what I felt. Even we've been seeing a lot of patients with cirrhosis, the complications of cirrhosis, all these patients who used to attend hospitals regularly at least once in a month or twice, once in 2 months, they have not been coming to the hospitals, and once they come back to us after 3 or 4 months, they come to us only because they have a blood vomiting or they have a massive ascites which needs to be tackled, and in spite of having the fear of COVID, unless it was very severe, they were not coming to the hospital. So all these things, patients were suffering because of the COVID pandemic and not attending the hospitals. So almost, I don't agree with one point what Dr. Mukherjee was saying. Lack of beds, I don't think it was always there. The beds were always available for non-COVID patients, but people were not ready to come to the hospitals. And more diseases were actually getting complicated and the diagnosis was delayed.
Yeah, I agree with you, because it was the fear which has gripped the entire world, which has prevented from people attending to the hospitals. And as from the medical fraternity, we were also clueless. We had to take care of ourselves and then the families. All these things probably has contributed.
Yeah.
One interesting question I would like to ask you regarding any cases of pancreatitis.
We had actually 2 to 3 cases of acute pancreatitis where the etiology was, we assumed the etiology is actually COVID, but we couldn't prove it. But after excluding other causes of acute pancreatitis, we had to diagnose it as COVID-related acute pancreatitis. And viral pancreatitis, we've been seeing multiple other viruses causing pancreatitis, but COVID pancreatitis is what we have seen during this pandemic. We have seen 2 to 3 cases in now.
And one more question to you. There was some controversy with regards to the use of PPIs. You say that it's a myth or...
Actually, when we are talking about PPIs, it's already been misused, sir. And during the pandemic, it was misused widely.
Okay.
That's what I can say.
Okay, thank you.
Thank you.
To another system that is not, there is no relationship, but it has had the effect over the entire body, that is endocrine system. We had cases of acute adrenal insufficiency, again because of the thrombosis. There was new onset of diabetes thanks to the use of liberal or over usage of steroids. And cases who are already diabetics, when they had been affected with COVID, the diabetes has worsened. We had also cases of thyroiditis where the thyroid gland gets affected. These were all the cases which, as internal medicine guys, we used to deal. I have one expert. I call him sir because we keep meeting at different platforms. Dr. Modi sir, and I can see my colleague.
That type of cases we have many more. And most of the cases, as Dr. Sreekanth said, it is either the neglected sugar because of fear of pandemic. Like many patients now also they come saying that it is a pandemic, that's why we are not coming. And sugar is totally haywire. They come after 9 months, 10 months, 1 year, showing excuse of COVID-19. So, in our country, in our region, yes, second wave was very horrible, and that time it was a valid reason, and we also closed our clinic and we were available only online, but that was only for 5 to 6 weeks period. Rest of the time we were available, but the fear of COVID made so many patients not to visit doctor either online or face to face. So diabetes got neglected, and those who contracted COVID, we all know that after morbid obesity and hypertension, diabetes is third biggest risk factor for COVID related morbidity and mortality. And especially uncontrolled diabetes, if COVID is moderate to severe, then outcome is very bad. So monitoring is most important thing, and that got neglected. Patients were not checking their blood glucose, and with uncontrolled sugar, if somebody contracts COVID, then complications are also more. And though people say that COVID-19 has triggered his diabetes, and otherwise he was not having diabetes. But after getting COVID only, he got diabetes and now it is continuing. But my feeling is, all these cases were hidden diabetes. See, they were not, no health problem was there, so their sugar was not checked. Because they got COVID, their sugar is checked, or COVID related medication, especially glucocorticoids, this disease precipitated their hidden diabetes. So I feel that COVID precipitating diabetes is mainly, it is like making a hidden diabetes overt because of disease or because of medicine, rather than per se virus causing initiating type 2 diabetes. And yes, even though they say that only 5% of COVID patients, they get serious, they require ventilator, but many of our patients, many of my relatives also I lost, those who had diabetes, and especially with background history, past history of cardiovascular event. See, even if he is all right now, but 10 years back, if he had some cardiovascular event and he is stable, and with diabetes, if he gets COVID, then many times he ends up with problem. I also lost 3 relatives. And age, even though pulmonologist and everybody says that all ages are affected, but I think that aged people, they have bad prognosis, especially after 75. If somebody gets COVID and if he has some background heart or lung disease or morbid obesity or uncontrolled diabetes, then it is horrible. So we need to be careful. And this COVID has started one more, opened up one more area, that is online consultation and online meeting. So even if pandemic gets over, then also I think that this possibility will always remain. So initially it was very difficult to consult somebody online. Why? Because online consultation, so many restrictions were there, and we were always worried that what is the official prescription we need to give, what is the validity of online consultation. But once the COVID came, government, they themselves made it official, and I think it will remain forever. So it will be a genuine reason for a person staying outside at a far distance to consult a doctor, and that will continue forever. And even on CME also, like we were attending this CME and all these programs face to face. But now this option will always remain open, that if you cannot come face to face, if you cannot come to meeting, you can attend virtually. So this is a gift COVID pandemic has given to us. Thank you, sir.
Sir, one question to you, sitting. It's mandatory, or at least most of us, we have used steroids. How many cases of acute adrenal insufficiency you have come across in, you can share your experience?
Actually,
the things become complicated.
Correct. Actually, this hidden adrenal insufficiency, hidden partial hypopituitarism, these are very common. And with any acute insult, they become overt. It precipitates adrenal insufficiency. And I lost one case due to this only. He had anticella, and he contracted COVID, and somehow his thyroid was taken care, but adrenal got neglected. So because of background baseline cortisol may come normal, unless and until you check both ACTH and cortisol simultaneously and correlate with imaging, then only you will know that this could be this empty-cellular related adrenal insufficiency. Otherwise, you will think that, oh, cortisol is 9 or 10, not to worry.
So we are likely to miss.
Yes, yes, sir.
Thank you, sir.
Thank you.
So-called diseases which have erupted during COVID, the psychiatric illnesses. While we were managing, we had seen cases with acute psychotic behaviors. People ended up with depression, and still we keep getting patients with phobias, chronic fatigue syndrome, persistent tiredness, and then sort of a weakness without any lab evidence. We have cases from the entire stretch of population, starting from the elderly to the youngsters, the adolescents, having anxiety, generalized anxiety disorders, and sleep disorders are something which are very common. I would like to take the experience of Dr. Harish Reddy, who is our expert, psychiatrist. Dr. Harish.
Thank you, sir. Thanks for the opportunity. Firstly, I'm glad has been the big 4 or 5, like the bigger 4 than we here. It's honor to share this with Dr. Mukharjee alongside. He's like a brother to me. So, psychiatric illness during COVID has been multi-pronged, sir, so to speak, because not only were there the direct effects of the virus, but the fact that the lockdown itself, or the fact that people have lost their businesses, livelihoods, have had, effect so hard. The impact was pretty bad. The other aspect of that was people who were, already under treatment. Acute stoppage of medicines that were available, because people in the rural areas, they were always mostly being supplied from the bigger towns, and suddenly when the lockdown was announced, like you said, some of them were the acute withdrawals that you would regularly see. But then there were others who were psychotics, who were schizophrenics. Yes. A week or 10 days without a medicine would be extremely bad, and it showed. And not only were there, the livelihood was lost, alongside they had the burden of managing a psychotic at home. And since it was multi-pronged, not only India, but across the globe, I think nobody was really ready for any specialty, but for psychiatry, I think it came as a big jolt. They were really taken aback by the impact of it. The global suicide rates itself doubled in the last 2 years. Okay. So generally, it was around 10 to 12 per lakh, and it has nearly reached 18. So that itself shows how much it has impacted. And when I say multi-pronged, like you rightly mentioned, sir, across age groups, across the social backgrounds, across educational backgrounds, we have seen kids starting from infants even, because they were always in most of the households hardly had ventilation, so there was hardly any room to go out, venture out, and the fear of having to go out with an infant or a young newborn or whatever inside the house, the impact it had. Then came the toddlers or school-going kids and the impact on them, because so many people had regressed, and rise in childhood anxieties, rise in childhood rage, rise in sibling rivalries, rise in nocturnal enuresis coming back. So there was across age groups, and the youngsters, the college-going population, or the older, the youngsters who were job seekers and all that. Generally, you expect them to lead a reasonably healthy lifestyle, but here there was always access to alcohol and tobacco. So the rise in the new entrants too, and we all know how cannabis has taken off, and it's all in the news also in the last couple of years because of the whole celebrity thing. So the use of cannabis, not an official study, but we see across our forums how the use of cannabis has gone up. rampantly, and since cannabis takes off, there have been wrongdoings, all social bad behaviors or misbehaviors. So it's multi-pronged. I mean, there is no end to how COVID has impacted. And directly, of course, COVID in itself was such an expensive illness, not just the financial burden of it, but the fact that so many people were laid off. Like Modi sir has said, how it allowed us to stay at home and do our consultations at times or attend the CMEs. Indirectly, however, I mean, such an event has so much of manpower involved. When this doesn't happen and you're home, so there's so many daily jobs cut, and that has a direct impact, of course. So we've all seen that. COVID virus as such, I think it continues to still haunt so many of the people, because I'm sure every one of our family members, be it distant or close, has been affected. Unfortunately, somehow it has been fatal to some, and the fear that it caused that will I contract the illness or will I contract the virus is so high. Already susceptible, anxious patients or already vulnerable people were, it just went up like drastically. I'm sure all you have seen in your OPs also how they repeatedly come for your consultations and they're worried about cardiac illness or other illnesses or general neurological illnesses. So it remains a challenge still because of the shortage of the number of psychiatrists, of course. But I'm sure most of you also deal with them the right way and you guide them and you advise them. But I think the fear of COVID is here and it will stay for some time, sir.
So, thank you. The virtual world, I think, has also opened the so-called black universe.
Yes.
The pornography.
Yes, of course.
All these things have gone up.
Yes. Also, the speeds of internet have gone drastically high and it was much easier to access the same. So, yes, the pornography, the black web has been really a worrying thing that has gone up.
Thank you.
One point.
I saw lots of cases with OCDs.
Oh.
Compulsive disorders. There is a, sanitizer. The fellow walks into the, PD chamber and he sanitizes at least 15-20 times before he leaves off my room in 5 minutes.
Interesting.
And they sanitize the chairs. It's literally obsessive compulsive disorder. I saw patients with hyperventilation. There's nothing. They also know pretty much. They have swabbed themselves more than 15-20 times in last 10 days. And they've got a couple of CT scans. They are not sure of, swabbing the, in one diagnostic, they will do other diagnostic. And the third thing, what I saw was post-traumatic stress.
That's
post-exposure. That's horrible. These three I could see.
Thank you. Pertaining to the nephro and neuro, but I would just rush through. Amongst the kidneys, we had dyslipidemia as a common presentation. Acute kidney injury and worsening of CKD were also observed. When it comes to the neurological involvement, headache, anosmia, probably are the commonest symptoms of COVID. Any COVID, whether it is a mild or moderate or severe, to start with. Central nervous system, we had cases of seizures, cerebrovascular accidents, and also meningoencephalitis, infection of the meninges and then the brain. We had cases of myelitis, the infection pertaining to the spinal cord, and acute inflammatory demyelinating polyneuropathy, what we use the word GBS, Guillain-Barré syndrome. We had myopathies and myositis also. All these cases were dealt by the physicians in assistance with the neurologists. Pregnancy is one area where I thought that is extremely important because we have cases of COVID affecting the pregnant women where there is increasing severity of eclampsia, increased risk of thrombosis, and probably a possible loss of
pregnancy and miscarriages. So friends, these were all the medical observations, and the way we tackled, our experts were there, they had given their opinion and their experiences. The path ahead, as I envisage as a lifestyle expert, is following the COVID appropriate behavior. Wearing the mask, of course, is mandatory. We start that whenever the ringtone of your mobile is on. Intensification of the vaccination drive, which again the government is handling. Effective antivirals production is one thing which is again extremely important to see that this virus gets vanquished permanently. And till then, I think having periodic health reviews, as I have mentioned earlier, every 3 months, especially with the COVID affected patients, and then depending upon the system which gets affected, they have to have the reviews from the respective consultants. This is my suggestions, and I have one so-called suggestions from our expert panel, one each for the so-called innovators. Notice sir, there are lots of young entrepreneurs and innovators. What's your take-home message and advice as a medical consultant, sir?
Actually, most important aspect and most neglected aspect of diabetes management is monitoring. I know that there are a lot of innovation in area of monitoring, like blood sugar testing, new type of glucometer, and smartphone connecting media and getting reports on this, and continuous glucose monitoring system. But this is the area where this digital innovation can do something. So if young entrepreneur, if they take this area of monitoring of diabetes, leave apart only sugar, even for blood pressure and for other biochemistry, you take any area of innovation in monitoring, it will be a very big boon for India.
Thank you, sir. Dr. SomaSekhar?
So,
Your take-home message for the young innovators.
yeah, I don't go specific to gastroenterology, but definitely one thing is lacking in our country. We have top experts, world-class doctors, and we have patients who are on the other extreme where they don't know what exactly their disease is. So healthcare awareness is lacking. Anything which can boost healthcare awareness in general public and help them reach their specialists for a specialized care is going to help. I don't know how it can be done, but maybe you should be thinking about that awareness to the common person where they can reach a specialist for a specified care. Thank you.
Thank you. Dr. Harish?
I think although we have access for a consultation online, but the last mile, delivery of the medicine at times becomes very challenging. I think if something like that comes up, but I think it also has some sort of legal implications or, the complications it might come with. So alongside whatever is within our law, I think something of that sort.
So
because in the rural areas,
outreach has to.
yes, I think it has to be a little wider. Yeah. Thank you.
Thank you.
Take a message from a
I
pulmonologist.
want further, because we have been discussing a lot of medicine,
True.
but for the innovators and then the entrepreneurs.
My suggestion would be first, get yourself vaccinated alcohol. My sincere suggestion would be that at least, limit it down so that it doesn't cause effects onto your organ systems. Third, a 45 minutes exercise every day, weekly 5 days might help me my take-home message than anything from pulmonology.
Thank you. Dr. Mukherjee has already laid the emphasis on exercises, and then he has spoken about obesity, the disastrous results during the COVID pandemic. Anything else, sir?
Yeah, before that, a couple of small things that I would like to.
Yeah.
Somasekhar, my good friend, told that the beds were not full. He was talking about Apollo, I was talking about general hospitals.
Sure.
Just kidding. And then regarding Harish, I need to tell a small thing. There was such a huge burden of psychiatric disease with the patients admitted with COVID in ICU that I had to take his help treating a lot of patients with them. And I would like to tell that Harish is not a first generation psychiatrist. His father is also a psychiatrist. Dr. Reddy, elderly gentleman, sweet little gentleman, you will love him the moment you say he got severely affected with COVID. Please don't mind me telling here. Okay. And then he was admitted with me in the ICU. I utilized his services to treat the patients who are besides him. He was breathless, and because of you guys, India can be number one in the world one day. It is not there yet, but we'll definitely make sure. And I was asked to present a couple of opportunities for the innovators. What if you do a good innovation so you can rock the world? There are two innovations that come to my mind immediately. If you can work on these, okay. The most important thing is transcutaneous monitoring of blood sugar. That is there. Many of you are working already on that. Multi-parameter monitorings you have been working. The thing with which monitors ECGs and then pulse oximeters, everything together. That unified device is going to come. A lot of people are working. You are working, GE is working, IBM is working, Siemens is working. You may lose that race. But I will tell you some things which you can do. One, a good mask has to be invented. 3M doesn't hold any thing of so big a patent. Now I am wearing a N95 mask. And this is definitely good at preventing COVID. But it is not comfortable. Let me tell you. Previously, when the SARS-CoV swine flu pandemic was there, I was asked to wear this N95 mask in my hospital. They gave it free. And after 10 minutes, I decided that I would rather die rather than wearing this mask.
Yes, I totally agree with you.
Yeah, initially. But COVID-19, I have a big scar here. I'm wearing my eyes water. I don't put the hand in my eyes for the fear of contracting COVID. So, you invent a nice mask, which is better than N95. Let's make it N99. But it should be so totally comfortable to wear. How you design it? It's up to you. Use your imagination, come with a good mask, and you will rule the world. You have to beat just one company. One company, no one else is there in the business. Beat that and you will be there. And the second big opportunity that you have a lot of vaccines now. You have mRNA vaccines, you have inactivated vaccines, you have viral vector vaccines. All these vaccines are there. And none of the vaccines is perfect. You will know that. None of the vaccines is perfect. It doesn't prevent the disease in 100% of the people, but our vaccines that we have, the Covishield and Covaxin, they prevent in about 70 to 75% of the people. Okay, that we know. But let us say there are 100 people here. Who are the 70% who are protected? Who are the 30% who are not protected? There is not a proper standardized antibody test so far in the entire world. The one that can come up with a proper test of efficacy of these vaccines. Now, you do this test, it will immediately tell you whether the vaccine that you have taken is effective or not. If you come up with such an innovation, you are the next Elon Musk. Okay? So, thank you so much, guys. Looking at you, I really feel happy that so many innovators are out there. Dr. Sreekanth, I'm really happy. Thank you very much once again.
Thank you, Dr. Mukherjee. I think it was a well addressed, and then the points are to be taken and then implemented with rapid speed. I would sign off ending with a positive note. Musically, this is a Sanskrit shloka which says, Loka samastha sukhino bhavantu, sarve jana sukhino bhavantu. This is absolutely the truth, the wellness concept. We want the entire world to be healthy, wealthy, and happy. Thank you, and your innovations are extremely important. They are necessary at this point of time. Thank you, sir.
Now invite Dr. Reddy conference onto the dais. Round of applause, everyone. So yes, everyone, this session was moderated by Dr. J. Sreekanth, Senior Consultant, Internal Medicine, Apollo Health Center, Hyderabad. A huge round of applause, everyone. Consultant Care Hospitals to please come forward. Thank you. Thank you, everyone. City Jubilee to please come forward. Thank you, everyone. Sahara Clinics, Kukatpally to please come forward. Thank you, everyone. Pulse Heart Center to please come forward. And lastly, I would like to call up Pulmonologist, Yashoda Hospital, Secunderabad to please come forward. Applause, everyone. Thank you so much to each and everyone. We are truly Thank you, everyone. Request you to please take your seats.